Fast food is so available, but not so healthy.
We live in a very bad neighborhood. I don't feel safe walking outside.
Many people simply try to eat their emotions.
There basically isn't a grocery store here, so we shop at the convenience store.
There is high fructose corn syrup in just about everything. You really have to read the labels.
Even simple exercising like walking requires good shoes. Most times, they're just not affordable.
These are the voices of women in Kent County talking about barriers to staying healthy. These are the voices of participants in the WISEWOMAN program. The program is designed to help participants understand their chronic disease risk factors and to help them in making healthy lifestyle choices. The program focuses on nutrition, physical activity, and smoking cessation. In an effort to better understand the barriers these women encounter, we used PhotoVoice, a research method developed by Carolyn Wang at the University of Michigan. PhotoVoice was designed to allow people to record and reflect on their community's strengths and concerns. It also encourages dialogue and knowledge about important issues by using large and small group discussions of the photographs the women take. And it becomes a way to connect with policymakers and community change makers. The WISEWOMAN PhotoVoice participants at Catherine's Health Center attended several photography classes taught by Dr. John Whalen, a physician at the center. After they learned how to use their cameras, they were asked to go out into the community and photograph what they saw that made it difficult for them to be healthier. Here is what they found.
I call this Temptation Alley. Even though I know it's unhealthy, it's easy to pick the quick fix.
The store may think this is a sale, but not me. How can I afford to eat fresh produce at these types of prices?
I live in a food desert. I only have access to 2 convenience stores. Otherwise, I'd have to take the bus to get a full-service grocery store.
The food pantries have to take whatever is given to them. I'm not able to get skim milk, which is a better choice than whole milk.
There are several empty houses in my neighborhood, and the trash is everywhere. It just doesn't feel safe or inviting to go for a walk.
Smoking is a barrier for me because I'm asthmatic and I'm allergic to smoke.
Where I live, all we have are country roads with little or no walking room, and the cars travel 50 to 65 miles an hour or more.
The environment in which we live plays a big role in our ability to stay healthy. And for those with a limited income, the barriers can be even greater.
I applied for a scholarship at the Y. It was $75 for the application fee, and then it was still $35 a month.
The sign says clearance for $9.99, but I have to pay rent and put gas in the car, and I might only have $10 or $15 left over.
I can't do weight-bearing exercise due to neuropathy in my feet. It would be great to have access to a bike, but not at these prices.
Even a gym membership for $9 down and $9 a month can be very expensive for me.
My sneakers were purchased in 2006. They're not comfortable anymore, but I can't afford new ones.
I wish more people offered layaway. Sometimes it's the only way I can afford to buy anything.
Getting healthy and staying healthy is not cheap.
Changing our behavior is hard, but for those with limited means, it can bring additional challenges.
I'm a full-time caregiver for an elderly gentleman, and it's hard for me to get away from the house to be able to go to the park or anywhere.
Sometimes I feel like my life is on a layaway plan.
On my income, the price of gas is always a limitation.
It's taking a long time to learn how to cook healthy foods. I grew up with meat and potatoes, and it's different when you have to cook healthy.
My mom died at 63. She was blind and an amputee. I don't want to end up that way.
I feel like I lack personal power.
We live in a house of cards. It could blow down anytime.
Our lives weren't always this way. It could happen to anybody.
But the women also saw many ways that the community supported them on their path to better health.
It was very helpful being part of a community garden this summer. It was my first time. The community garden was a great place to make new friends and develop new interests.
The raised beds in our community garden provide a great solution for people with limitations.
Hey, there are several pickleball courts around the city. It's a fun, low-impact way to get exercise.
Mobile food pantries are a big help. We're fortunate to live here. We need to take more advantage of all our state has to offer.
And from it all, they learned a lot about themselves.
It's all about baby steps and small, permanent lifestyle changes.
You don't need a lot of space to grow a bit of fresh produce. It's one way to eliminate the store prices and the pesticides.
Grow locally, eat more locally grown.
The reality is, I can't place the blame elsewhere. It starts with me. I was my own biggest barrier.
We need to stick together to work as a unit.
And that's exactly what this group of women intend to do.